This webinar is presented by Dr. Dan Kalish. Dr. Kalish is dedicated to teaching doctors functional medicine philosophy and practices. He has trained over 1,000 practitioners worldwide in the Kalish Method, which solves patient challenges through a proven lab-based approach by means of the Kalish Institute's educational programs. So Dr. Kalish, whenever you are ready, take it away.
Thank you very much. Today, first of all, welcome everybody. And for those of you that don't know me, um, I've been in practice for a long time. I've been in practice for half my life. I did the math yesterday, and I was like, whoa, that's kind of scary. I've been doing this for a long time. I've been focused on GI testing and GI programs since day one because my main teacher was a GI guy. And now I've kind of managed to get myself into like all these interesting positions. So I'm a lead faculty at the Institute for Functional Medicine's Practice Implementation Program, teaching people how to start practices really, and done some research with the Mayo Clinic of partnering now with one of the leading scientists in our field, Richard Lord, and doing a lot of advanced lab interpretation stuff. Actually IFM certified, which means I'm kind of like a legitimate practitioner. But really what I want to talk about today is, you guys and your practices and how we can make a go of this so that GI testing is sort of demystified, easy for you to explain to patients, easy for you to, get the testing done. And the main block that we see really for most of us is just the lack of confidence that this stuff is going to work, And I think that that's kind of the main goal of today, is to just give you some ideas around that. So I want to talk just briefly over these slides, but not for too long, and then look at some cases that are, real cases that we can actually treat, and then talk about, how all this can actually play out. We'll have plenty of time for questions at the end, okay? So the key principal point we want to make sure we remember is that GI dysfunction can occur with or without GI problems. And this takes several years to kind of sink in, that you can have a patient with major GI problems that has no GI symptoms. That's one of the hardest concepts for most of my students at the Kalish Institute to get. It takes a couple years for that to really sink in. I can say that, you can say that, but where the moment you know that you believe that is when you do a stool test on every new patient. When you do a stool test, when you order a GI map on every new patient, on a 3-year-old kid that has a skin problem, on a 58-year-old adult that is depressed, on a 27-year-old that wants to get pregnant, on a 32-year-old that's an athlete that wants better performance. When you start to order a stool test on every single new patient, then you're going to realize, wow, this is really true. You can have major GI infections with no GI symptoms, and this person's H. pylori just caused some fatigue, no GI problems. This person's Giardia caused her to have an autoimmune illness, but there's no GI symptoms, right? And so again, I think that's one of the harder things to sort of get your mind around in this whole field. So I'll just keep saying that. Hopefully you can repeat that to yourself a bunch of times, but you'll know that you believe it for real when you convince every new patient to do a GI test. And why does it even matter? Because the GI tract impacts our immune system, our brain, our liver. The cardiovascular system is profoundly influenced. Even your metabolic rate and how you burn fat and whether you're overweight or not is controlled by your microbiome, right? So these are really important kind of big picture concepts to start off with. Okay, and then in terms of treatments, which is what we're going to focus on today, really just breaking it down to three different categories of treatment. And as we look at these labs in a minute, wrapping your mind around how each of those treatments can play out, okay? And so the three treatments are, so as we look at each lab today, we're just thinking, does this person need prebiotics, polyphenols, probiotics, fiber? Okay, and we'll get into a little more detail on what that means. Does this person need, item number 2 here, enzymes, gallbladder support, leaky gut repair, GI immune boosting? Third item, does this person need antiparasitic, antibacterial, and anti-yeast herbs? And this is like the sum total of everything that I've ever done in my practice in 28 years for gut problems. Okay, and how many supplements are there? There's maybe like 3 here, 3 or 4 here, and then 2 or 3 choices here. So you gotta learn like 8 or 9 things to make this whole, functional medicine testing program work. Okay, so it's not that bad. The labs look complicated, but the actual treatment options are, you know, finite, very finite. So I've broken it down into 3 stages. Stage 1, the microbiome is messed up. Stage 2, the organs are not doing well. Stage 3, yikes, there's a pathogen, there's a GI bug. Treatments for each one, boom, boom, boom. Which one does a person have? Maybe they have all 3. You look at the test, you can figure this out. On the GI map, you very clearly will see the commensal or normal bacterial markers. If those are all cattywampus, as one of my patients used to say, high or low or all over the map, you know that the microbiome is disturbed and that you should do a stage 1 type treatment. If there's an organ issue with the gallbladder, pancreatic enzymes, that kind of stuff, leaky gut, you can treat the organs. And then if there's a pathogen, it'll show up with all these red marks everywhere, kind of hard to miss those, right? So question then, as we look at each one of these labs, is there a stage 1, 2, or 3 going on? Which one do you want to treat? Now, let's say all 3 are going on. Which one do you want to treat? Well, if you're just interested in being entertained by the miracles that may occur, I would suggest starting in general with treating the pathogens, because that's where people's lives really miraculously change. We had a case in the Kalish Institute last week. It's one of my favorite doctors in the class. I know you're not supposed to have favorites, but anyways, Lars, he's this medical doctor from Germany. He ran a testing. She had a 5-year-old kid, GI problems, 5-year-old autistic child. True story. He's telling this to the whole group. We're all like on the verge of, tears when this was happening. The kid starts speaking for the first time in her life. Her parents didn't think that she could speak. Obviously, she's speaking German, not English, but she should speak German for the first time in her life right when he initiated the GI treatment. Miracle cure. We're all crying on a call. People are like, this is incredible. What did you do? Gluten-free diet, treated the GI pathogen, 5-year-old kid with autism starts to talk again. Okay, so now that's a once in a career kind of case. I'm not saying that I did that this week because I didn't, this was Lars. But Lars will now test every single patient for the rest of his career for GI bugs. Okay, because now he really sees the power of this. And that's what we're trying to convey here is, if you haven't had a miracle case like that in your practice yet, then trust people like Lars or myself who have, and you'll realize, wow, I really need to do this for everybody. This is not like an optional thing for people that have digestive problems, okay? It's not a niche test that I just use for those people that have, IBS, IBD, and Crohn's disease. This is like the central test that we do in functional medicine is to look at the microbiome. So you have to order it for everybody, okay? And you'll get miracle cases too if you can stick with that. And again, I want to keep this talking part short, so I'm going to skip through the slides kind of fast. They're there for your reference if you ever want to look at them in the future. But what we're doing from a clinical standpoint, then again, complex lab data, but just 3 questions. Are the normal bacterial flora at a balance? Yes or no? If yes, microbiome is disrupted. That's our stage 1. The next thing, and you should look at that first, right? And it's not in the first part of the test. Just skip to that part of the test. Look at that first. The next thing is, are the organ markers positive? That's at the very end of the test. So now you're going to skip from the middle to the end of the test. And you're looking at that. You're like, wow, yeah, the gallbladder's not working well and the pancreas is not working well. Check. This person has stage 2. And then you got to scan the whole test to see, are there parasites, bacteria, or yeast present? So again, this is how to analyze the lab. You grab the lab, you look at the microbiome part first. Is there a problem there or not? You look at the organ part at the end of the test, problem there or not. And then you look and scan for bugs. Okay, and then if all 3 of these are present, you can treat stage 3 first, then do the 2, and then do the 1. It's hard to treat all of these at the same time. Sometimes you can mix and match things, and we can go over some cases in a minute to kind of see how that can play out. But that's the basics, all right? Stage 1 markers, microbiome markers. It says normal bacterial flora. These are the good guys. In this case, you can see some of them are low, and Akkermansia muciniphila is high. That's an imbalance in the good bacteria. That's a microbiome imbalance. So right off the bat, this person has a microbiome problem. And what are the treatments for that? Prebiotics, probiotics, and fiber. Prebiotics, probiotics, and fiber to balance out the microbiome. And if you want to get really fancy, like super triple fancy, you can use butyrate. And butyrate is now available from a bunch of the different supplement companies. And that's like the ultimate kind of microbiome balancer, just to give someone butyrate. Pretty profound kind of thing to do if you want to get fancy. But the basic supplements, prebiotics, probiotics, and fiber. Extra fancy for extra sick people, you can use butyrate, right? And several of the major companies have that available now. So again, right off the bat, that's the first thing that I would look at. How is the normal bacterial flora? Are they low? Are they high? Okay. Again, here's the treatments: fiber, prebiotics, and probiotics. And polyphenols are, you can measure polyphenols in organic acids testing also, which is kind of cool that you could even do that. But polyphenols are, what you think of when why do you eat blueberries in the first place, right? Because they have a lot of polyphenols in them. So you can do prebiotic containing foods. I like to supplement these things. Most people are so busy. I mean, how often are they going to really go buy organic blueberries and eat them, and they're going to go bad in the fridge? And so anyways, if you have someone who's sick enough to be doing these kinds of tests, it's probably better just to do the treatments with supplements first as you're getting them to change their diet. And then once their diet has improved, you can withdraw the supplements, right? So of course, fiber, prebiotics, and probiotics can be supplements. You can also eventually get them to do that with food. Stage 1, microbiome. Stage 2 is what's going on with the organs. There's not that many organs: gallbladder, pancreas, intestinal tract. Is there something wrong? And if your gallbladder is not making enough bile, you're going to have a massive overgrowth of bacteria in the small intestine, because one of the jobs of bile is to nuke all those bacteria, right, and balance things out. If you're not making enough pancreatic enzymes, you're not going to break down your food, and all kinds of chaos is going to go about in the gut because of the lack of enzymes. And if your intestinal tract is inflamed and all messed up, then nothing's going to work right. So stage 2, we're now thinking there was a microbiome problem, the bacteria are out of balance. Oh gosh, now it's looking worse. The organs of the gut are involved. The maldigestion, the malabsorption is a direct result of organ dysfunction now. And of course, the immune response starts to weaken, the gut gets inflamed, and all these things. So pretty easy to find. You see the steatocrit marker there. If that one is out of range, then there's a gallbladder problem. There's a problem with an organ. Again, if elastase is out of range, there's a problem with the pancreas. And if these markers down here under immune response and inflammation are out of range, then there's a problem with the inflammatory response. The gut lining is damaged. So again, gallbladder, pancreas, and gut lining, do you need to treat those? Is there a stage 2 present or not? And this is at the end of the test. So again, when I'm working with patients, I don't look at the tests in order of the way it's printed. I look at it in the order of stage 1, stage 2, stage 3. So first of all, looking at the commensal markers and talking to them about their microbiome. Gosh, Jane, your microbiome doesn't look that great. And then she's like, wow, I took antibiotics 16 times last year for bladder infections. Maybe that's why. I'm like, yeah, maybe that's why. Okay. And then skipping over to the end of the test here, your GI organs. Let's see, how are your organs working? Well, I don't know. There's some inflammation here. There's some leaky gut. Your gallbladder doesn't look like it's as crisp and beautiful as we would want it to be, right? So you get that done. And then again, the treatments here, pretty straightforward. If steatocrit is off, gallbladder. If pancreas, if elastase is off, then digestive enzymes. And don't underestimate the power of gallbladder treatments, because gallbladder treatments can completely change a patient's entire life. Like gallbladder is like, it's like the underrepresented kind of, not appreciated organ. It's really, really, really important. In fact, a large percentage of people that have SIBO type problems have gallbladder problems also, right? So just keep that in mind. Think of gallbladder function is as important as the whole SIBO thing is. Think of it that in your mind that way, okay? Super, super important. And then leaky gut, anti-inflammatory stuff. That'll show up on this portion of the test. So again, it's at the end of the report, and I'll just skip around, right? Like here's your commensal bacteria, here's your organs, and then look at pathogens at the end. So steatocrit abnormal, gallbladder support, and all the companies have good quality gallbladder support with oxbile and whatnot. Elastase abnormal, you give enzymes, and then if the SIG-A or these other inflammatory markers are off, you do all the glutamine-based powders, anti-inflammatory support. Okay, now we're getting to the interesting part. You've looked at the microbiome, you looked at the organs, now you're like, are there any GI pathogens or not? You could treat the microbiome, you could treat the organs. If the pathogens are present, usually you want to start here. Why do these pathogens even come about? Because of a weakened microbiome and messed up GI organs. That's what leads to these problems in the first place. But if they're present, in general, it's kind of nice to take care of them, so to speak. And is there a parasite present, like blasto or Dientamoeba fragilis? If so, you want to eliminate it. Is there H. pylori present? Probably my favorite infection to treat because it makes such a big difference for people. Is there something like C. diff going on, right? There's many different possibilities in all, right? And then, and this is confusing for everybody, for patients, right, for sure, is that there's also these opportunistic bacteria. So these are not commensals. These are not normal, healthy organisms. These are kind of bad actors. They're not really full-on pathogens. People don't die from these, but they can cause what we call dysbiosis, right, if they're out of balance. So whereas with the microbiome section of the test, if the bacterial markers are high, like high Akkermansia, you don't really want to kill Akkermansia generally, right? That's a good guy. But if these markers are high, then we consider it fair game to take them out, right? So if you see a variety of these markers that are high. And then this one, obviously, if there's a yeast or fungal overgrowth, you definitely want to clear that out because that's just going to be annoying and unpleasant for people. Okay, so amongst the stage 3 protocols, either parasites, bacteria, or yeast, really simple in my practice. I have like 2 or 3 different protocols I use. One for all the parasites, same herbs for all the parasites, basically. I know that kind of seems a little chintzy, but it seems to work. I've been doing it for 30 years. My teacher, Dr. Timmons taught me this in the 90s. And he was doing it since the 70s. And I don't know, this has been going on for 50, 60 years, really solid antimicrobial herbal programs. There's not a lot of new herbs, right? I mean, oregano has been around for a pretty long time. Artemisia has been around for thousands and thousands and thousands of years. So, but they work really well, okay? Then programs for H. pylori and C. diff, and then programs for yeast overgrowth. So you don't even have to memorize a ton of different protocols, but you do need a few, right? And again, summary of all this, Stage 1, imbalanced in the normal bacterial flora. Look at that first, because that's the origins of all these problems. The microbiome is super important. You can talk to people about their microbiome, how it controls immune function, weight balance, fat burning, I mean by that, how it controls cardiovascular function. It's not just about your gut, right? It's about even the hormone balance is dictated, and inflammation throughout the body is dictated by gut function and the microbiome. So you want to have a couple-minute spiel you can give to people about their microbiome and how that relates to their symptoms, right? So you might have to read a little bit about how does the microbiome relate to immune function? How does the microbiome relate to autoimmune disease? How does the microbiome relate to the brain? You spend a few hours, on a weekend sometime reading up on that. So you have some things to talk about when you're talking about the microbiome, but that's the most important part of the gut, obviously. There's, thousands of research studies coming out every year now, tying the microbiome into every known disorder that humankind suffers from, right? So it's a pretty important thing to be able to talk about for a few minutes, and it's a wonderful thing that you can test your patient's microbiome. So when I'm trying to sell these labs to patients, I always say, if you've heard about the microbiome, and people these days, 10 years ago, people would have been, what? But these days, almost everybody says yes. Well, I think we should test and correct your microbiome. And people look at me like, what? Like you can even do that? I'm like, yeah, that's how special I am as a human being. I'm kidding. I can do that. I could do this. And guess what? It's a DNA-based test. Then people just go ballistic. They're so excited. They're like, you can do my microbiome test? I'm like, yeah, it's based on DNA. And I get into, a couple-minute discussion about the DNA. It's incredible that you can do this, that you can find the DNA of organisms in stool. Like that's a mind-numbingly cool thing. And then 110% of people will buy the test if you just pitch it that way. I want to test and correct your microbiome. I think it's directly related to your immune system. Here's why, and your immune problems that you've been suffering from, and it's done from this PCR DNA-based test technology, which is like so cool. 110% of people will buy the test based on that. If you talk about like parasites and bacteria, maybe not quite as sexy and interesting to people, but the microbiome thing works really well, okay? And then of course, we're also looking at these other 2 stages. But in terms of explaining the test, I really focus on the microbiome because that's such a buzzword these days in general across the board, right? So again, treatments, and let's look at some labs here. And I want to show you some real examples about how this can all really work. And then we have a GI map masterclass. If you guys are interested, you can check that out too. I'm sure we can get you some links to that. KalishInstitute.com/GI map. Use the code GI map. It's free. Oh, well, that's kind of like, okay, well, why would you not do it if it's free? Usually we sell them for like 50 or 100 bucks. And then we have a boot camp coming up too in November, okay, that you guys can look at. So let me pull up some cases here and we can jump into that stuff. Case number 1. So in the mentorship class that I teach, doctors submit labs and they submit a case study, and then we review these every week. And the GI map is always very popular. So this is from one of our docs named Jacques, 25-year-old male, Amish farm worker. That's pretty cool, right? Who would have thought? Look, this totally proves the point. What's his number one complaint? Infertility and poor sperm quality. Okay, so this patient walked into Jacques' office and said, Doc, hey, I'm Amish, I'm a farm worker, my fertility is not really there, I want to have kids. And what did Jacques say? Did Jacques say, oh, I'm going to do like some complicated workup? No, Jacques said, I'm going to test your gut because Dr. Kalish said that we always got to test the gut no matter what the problem is, right? And so let's see what happened. And this is the GI map, right? So we're going to look at the microbiome part first. Oh, I know it's hard to skip by these other parts, but here we go. Normal bacterial flora. Clostridia as a class are high, Enterobacter species are high. So is that a perfect microbiome? No, it's a little off. It's a little off. Then we're going to skip down to the bottom of the test. We're passing all this good stuff here just to see what's happening with the organs, right? And gallbladder and pancreas look okay. Sig-A is low, zonulin high. Sig-A being low in and of itself lets you know that the gut lining is damaged. The immune response in the gut is inhibited. The immune response in the gut is inhibited. That is not good. So this person needs some gut repair and some improvement in the gut lining in that organ, right? So pancreas, gallbladder, good. Small intestinal tract, small intestine, not good. So we want to do some intestinal tract repair. So we know there's a mild microbiome problem, small intestine issue needs to be repaired. Then we're going to go back up to the top of the test to review it for pathogens. So if this patient was coming in, I would say, hi, Amish farmer guy. I don't know, let's call him John, Farmer John. That's not very funny, but so hi, John. Here's your microbiome results. You know, they look a little not so great. You know, your gut, there's some inflammation or tissue damage or something's damaging your immune response in the gut. Show them that and then talk about, gosh, there's a few bugs here. H. pylori is positive, it's high. Okay, so that's an infection in your stomach, which is going to inhibit absorption, digestion of nutrients. And then we've got some dysbiotic bacteria that we need to clear out as well to reduce inflammation. There's a yeast or candida overgrowth. It's amazing how messed up people get. There's a yeast or candida overgrowth, and then you have blastocystis hominis. Okay, that's just like a headache worth of stuff. Okay, so what are we going to do? Well, we want to treat the pathogens first, the H. pylori, the yeast, and the parasites first, then come back around. And you can do these things simultaneously if it does not overwhelm the patient, but usually getting rid of the pathogens first, then come back around and do all the leaky gut repair, stimulating of the immune system. Sometimes you may be able to get away with overlapping those two programs together, but you know, usually it's a little too much to try to give that many supplements all at the same time. So let me just show you real quick on a program how that would work. And so we've got 3 bugs. So let's think about this. We've got H. pylori. We've got, what was it, blasto. And we have a yeast overgrowth, which seems to be paired with some dysbiosis. So this always comes up in class. Well, there's so much to do. What do I do first? In fact, I think Jacques even asked that as a question here. Let me see, didn't he say that? This is a lot to handle, you know. He has this, 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 and that, right? So what we would then start with is, and I've always followed this order. Why? Because this is what Timmons taught me, and it kind of makes sense. Start with H. pylori, start at the top, you know, with the stomach problem, then deal with the parasite, blasto, and then at the end of the program, eliminate yeast and the dysbiotic organisms. Oftentimes, if you start with H. pylori, you improve stomach function. Now the stomach's able to more adequately produce stomach acid. Now you're able to kill a lot of these organisms in the stomach before they get in from your eating. Just the health of the gut's really starting to improve. Then you eliminate the blasto. Oftentimes, by the time you get through both those programs, you're going to have already eliminated, kind of inadvertently the yeast and the bacterial problem. Okay, so for H. pylori, I always use mastica. And you want to get the dosage up pretty high. It should be 1,000 milligrams 3 times a day, whatever company you use, whatever product. And that's a 2-month program. And then you want to use some kind of anti-inflammatory. Now, some of these companies will have the mastica mixed in with an anti-inflammatory herbal product. So that's kind of awesome. If not, you can use, depending on what company you're using, if not, you can use, DGL or some kind of anti-inflammatory gut powder. But you want to have the mastica at 1,000 milligrams 3 times a day, along with either anti-inflammatory support built into the mastica product or a separate anti-inflammatory product for 2 months, okay? And that should most of the time clear out H. pylori, assuming that you're following, other protocols, you've got the diet cleaned up, you're working with your adrenals and that kind of stuff. I didn't spell that right, sorry about that. Then you pause for a moment, take a deep breath, go after the blasto with antimicrobials. So for that, parasite programs always do the same thing. I do a combo product, Parex, Paratid, this, GI Microbe X, they always have some kind of X in them or like, Xing something out. But anyway, so combo X product, right? And they'll have Artemisia, berberine, grapefruit seed extract, some combo product. And then I always use 2 single ingredient products. So the single ingredient product could be oregano. I use that a lot. That's really effective. It could be, so I'll say 2 of them, okay? Single ingredient product. It could be berberine. That's really effective for these kind of bugs. Could be grapefruit seed extract. Could be silver, colloidal silver. But anyways, 1 combo product and then 2 single ingredient products all at the same time. Just wipe it out. That's after the H. pylori. Now you can see a lot of this is also going to be anti-yeast and anti-dysbiosis. So a lot of times during the parasite program, you're going to get those other bugs cleared out too. So right out of the Dr. Timmons playbook, I learned this in 1994, something like that. I've been doing this exact set of protocols for whatever millions of years that is. I haven't changed it at all from what he taught me because it works really well. And we've put over 1,000 doctors through the Kalish Institute mentorship. They all have done these. Works pretty well for them too. Worked for Timmons. Worked for all the people he trained. These are just old school naturopathic things I'm passing on down from the old school naturopaths that trained me. But don't get all wussy and weak about it. Don't give them like, I see this all the time. It just drives me crazy. Like someone will give the parasite 1 combo product, a single combo product, and they'll give like 1 3 times a day. That's an anemic response, okay? That's like if you're watching a World War II movie and the guy comes up to like a tank, like a German tank, and the American soldier's like firing his pistol at it or something. That's not going to get anything done, right? You got to get the guy with the bazooka thing that can fire the bazooka little torpedo thing at the tank and maybe you'll blow it up, okay? So don't underdose people. Get aggressive and do some killing here. If you're going to go after blasto, don't give it a bunch of warnings and be nice to it and, just wipe it out, okay? Don't make people sick. Don't send people to the hospital. You got to monitor patients. You got to make sure their liver function can handle it, okay? You got to be, if they're on a bunch of medications and they're chronically ill, don't do this, right? You got to be, responsible and make sure that no one's liver is going to go kaput on you. But at the same time, if you get all your ducks lined up in a row here and you've got good liver function, they're not on too many meds, just go for it and knock out the bug. But don't do like a couple of pills a couple times a day kind of thing. It's just going to piss off the blasto and it won't go anywhere, okay? Oh, and I should show you this other thing, like in case you think I'm just totally a mad person and irresponsible and crazy. We actually did a study on this. This was the peak of my academic career. Lasted about a year. And I don't know, about 10 years ago, Sue Cutshall and Larry Bergstrom from the Mayo Clinic took my class. They took the Kalish training. In fact, as a side note, Larry took the training program twice, which is kind of cool. He's a really good friend of mine. I love this man. He's a really great guy. Anyways, and then they're like, if you know, after they took the class, they're like, well, we're at the Mayo Clinic. This is what we do. Let's do a research study. And I'm like, oh, I've never done that before. And they're like, okay, well, we'll help you with it. So I did a research study with the Mayo Clinic, and what are you going to study? And I was like, well, let's just study what I do every day, adrenal and gut programs. And so this study looked at adrenal and gut testing in 25 women, okay? And we found out that these supplement protocols really, really work, okay? It's not some random thing, it just works for me. They're very, very effective. Even the Mayo Clinic kind of put their stamp of approval on it, right? Okay, one more case here from Sarah. What are the top 3 complaints? Fatigue, low libido, brain fog, hair thinning. I don't see anything about gut in there, okay? I don't see anything about gut in there. So now, why did Sarah do a gut test? Because she's in the mentorship class with me, and that's embarrassing if you don't, right? If you show up to the mentorship class on Tuesday night and you present a case without a GI test, people will be like, what is she doing? Like the whole point of functional medicine is to do GI testing. Why didn't Sarah? Everybody in my class does a GI test, okay, on every patient. And then what ends up happening? You find all kinds of chronic infections on these people, like H. pylori is another one, right? Over and over again, okay? And then you realize, wow, when this gets better, their fatigue gets better. And then once you've done maybe 20 or 30 of these, you'll be convinced I should do a GI test on everybody. That's kind of the heart and soul of functional medicine, right? So let's see, blasto kind of borderline. Let me pull up another one here. There's another GI map. We first look at the normal bacteria. You see Akkermansia is high. That's a good guy. Do you want to kill that? No, you don't. But you're just seeing there's an imbalance in the microbiome. It's slight, it's not significant. And then you flip down here and you look at the organs. Remember, the next thing you talk to the patient about is their organs. And it's like, oh, there's some blood in your stool. That's usually a referral, right, to a GI doc. Make sure they don't have colon cancer or something like that. Gliadin marker is super high. Okay, that means you got to have a serious talk about gluten and getting them off of gluten. And then calprotectin is high, so there's inflammation in the intestinal tract. So gallbladder is fine, pancreas is fine, intestinal tract is inflamed, so they need treatment for their gut lining, right? Anti-inflammatories for their gut lining. And then we're going to go back up at the beginning of the test and look for the bugs, right? So first page looks clear. We're just looking for really bad red marks here. We talked about Akkermansia already. There's some dysbiotic bacteria, a whole bunch of them. There's a yeast overgrowth. And then there's a parasite called Pentatrichomonas hominis. So if we cut over to our list that we launched off with here, right? This person has a mild stage 1, stage 2, they have a problem with leaky inflammation in the gut, right? And then they have parasites, bacteria, and yeast, right? So we want to treat all 3. So how do you do the treatments for that? So now this case, we're going to redo this, and we're going to say this person has a parasite. It's a Pentatrichomonas. They had yeast and dysbiosis. So in this case, the parasite program would go first. So whenever parasites are present, always treat them first, unless it's H. pylori, in which case H. pylori gets the precedent. Okay, so always treat parasites first, except for if H. pylori is there. So they need, and they needed the anti-inflammatory support, right, for gut repair. So, so you need anti-inflammatory support for the organ, right, for the small intestine, and then the exact same parasite combination program that we just talked about, a combo product, 2 single ingredient products. Don't be shy, don't hurt people, don't send them to the hospital with a liver problem. Monitor people, if they're on medications, be careful, but, don't, use a squirt gun when you need a bazooka, right? You want to make sure that you're killing these things, and it takes a little bit of work. Once the parasite program was completed, then you would, in this case, you would do an anti-yeast program right after that, okay? So treatments for each stage. One more little thing here, and then we can take some questions. We have a GI masterclass. It's not even cheap, it's free. We're just giving it away. And you'll learn more about it, and you'll learn more about test interpretation. And if you're gung-ho about business stuff, you can check out our boot camp, which is coming up in a couple weeks, Business Essentials Boot Camp. Today's webinar attendees get a 20% discount on the boot camp. I don't think we've ever given discounts on boot camps before, so this is kind of extra special. You put in DSBiz at checkout and you get 20% off that class. And the class is like around $1,000 bucks, so you'll save a couple $100 with this. Okay, if you want to get a little more into the business side of things, we have that coming up in a few weeks. These have been really popular courses too, if you guys are interested in that, financial planning, business planning, that kind of stuff. All right, so I'm going to open it up for questions.
Yes, great. We actually got so many good questions and we might not get to them all. But the first one is, I've heard that butyrate is to be used in caution with someone with SIBO and they want to know what you think.
Well, why do they have SIBO, right? So SIBO is very commonly triggered by gallbladder problems, as I alluded to, and by yeast overgrowth in the intestinal tract. Real SIBO, if they have real SIBO, it's a peristaltic contraction problem, a mechanical problem with the small intestine. So it's if you're sure they have real SIBO, their gallbladder's fine, they have a yeast overgrowth, and they're in the middle of a SIBO treatment, probably butyrate's not appropriate. So I would agree with that.
Okay. And then the next question we have, and I think you might have answered this, but it can't hurt to reiterate, is do you treat H. pylori and a parasite at the same time?
Oh, no, yeah, but that's a bad idea, okay? Almost always a bad idea, because you're giving somebody that much mastica, there's not a whole lot else you can fit in terms of killing. So, and if you underdose the mastica, then you don't get rid of the H. pylori. So most people massively underdose mastica, and then they wonder why the H. pylori treatments don't work. So I think you're much, much, much better off to do them one at a time, and to not try to rush things, and just to getting rid of one major infection, is a pretty big deal, and trying to do two at the same time is pretty hard.
Okay, great. Thank you. Someone else asked, what do you do if you see high markers in the flora after treating with the prebiotics, fiber, etc., and you see a lot of the other markers raise?
High markers in the normal bacterial, is that what we're saying?
It just says, what do you do if you see high markers in the flora after treating with prebiotics?
I'm assuming that we're talking, well, flora is kind of ambiguous. I'm assuming they mean the normal bacterial section, right? And so if you see high markers in the normal bacterial section, then that could be, it's difficult to know, right? Obviously, if there are low markers there, it means the microbiome is sort of underpopulated and you want to give prebiotics and probiotics to bring it up. If the commensal or normal bacterial markers are high, you're not looking at all the thousands of organisms, so that can be a okay thing. It can be a sign that there's an imbalance between the good bacteria, and the good bacteria are broken down into like maybe 3 different subsections. So some of the good bacteria make hydrogen gas, right? Some of the good bacteria make short chain fatty acids that we were just talking about, like butyrate. And some of the good bacteria consume hydrogen gas. So there's 3 sort of general groupings of them. And we didn't have time to get into that, but sometime I could come back and do a lecture on that if you guys want. And so depending on which bacteria are high or low in the normal bacterial section, you may want to encourage certain ones to grow out to impede the growth of other ones, but in general, you don't want to kill anything, okay? And so sometimes the hydrogen producers are insufficient, which means the hydrogen consumers are going to be insufficient, right? Because they're relying upon one another. And so it's a little complicated, but that's the way I look at it, in these different functional groupings about what those commensals actually do and what their food supply is. But that's not a very good answer, but because it may be hard to answer it directly. But if whatever you did seems to have thrown the microbiome off, then I would switch things up, because the treatment options, again, are fiber, prebiotics, or probiotics. So if one thing seemed to drive the organisms a little too far in one direction, you might want to shift strategies.
Great, thank you. And you did mention fiber. Someone would like to know, what fiber do you recommend?
Well, psyllium fiber kind of is the easy one. Some of these companies have really fancy fibers, which I think is kind of cool. And some of them will have like prebiotic formulas that have a bunch of fancier types of fiber in them. But if you want to keep it kind of cheap and simple, then psyllium is probably the easiest. And then if you want to do it with food, then the best fiber for the microbiome, and this is for the hydrogen producing bacteria, right, which are essential, because remember, if you stimulate the hydrogen producing bacteria to grow, a whole bunch of these other organisms that are good, the good guys, need that hydrogen. They use that hydrogen for their food supply. Okay, and the best way to make that whole thing happen is to get people to eat beans, legumes, or beans. Lentils are the best, but black beans will work, pinto beans, kidney beans, hummus, whatever you can get people to do on a regular daily basis. Small amounts of beans in their diet. That fiber will get the hydrogen producing bacteria to grow, and then the hydrogen consuming bacteria will start to grow, and then everything gets really happy.
Okay, great, thank you. And then we have another one that says, how do you determine if you treat H. pylori if it is there but not showing high? Do you always treat it if you see it, even if there are no symptoms?
No. So, well, first of all, H. pylori is my favorite thing to kill because when you kill H. pylori, amazing things happen. The stories that people tell are just like entertaining beyond belief, of things that get better. So it's always something to keep an eye on. If if H. pylori, if the patient has symptoms which you're suspicious of, like they're extremely fatigued for no reason, or they have all kinds of food allergies, or there's something, or they have a horrible inflammatory problem, then I always think it's worth getting rid of H. pylori. So it's one that I would probably treat more often than some of these other bugs because it can make such a big difference.
Great. Well, thank you so much. That is all the questions we have time for today. We did get some more that we will send on and have answered. So thank you so much, Dr. Kalish, for being here, and thank you everyone for listening today. Have a great day, everyone.